Autonomic nervous system drugs. The autonomic nervous system, also abbreviated as ANS, means involuntary. We mainly are talking about the brain and the brain stem and the spinal cord when we're talking about the autonomic nervous system. The autonomic nervous system is divided into two categories, the sympathetic and the parasympathetic. The sympathetic is the alert system. We often call this the flight or fight system. This parasympathetic system is the resting and digesting system. Also within this system we have neurotransmitters, which are chemical substances released at the nerve endings to send an impulse to surrounding tissue or glands. Neurotransmitters are also called catecholamines. Some examples are dopamine, epinephrine, and norepinephrine. ANS drugs are divided into four categories: adrenergics, adrenergic blockers, cholinergics, and cholinergic blockers. Adrenergics mimic the sympathetic actions. Adrenergic blockers block that action. Cholinergics mimic the parasympathetic actions, and the blockers block the parasympathetic action. Adrenergics increase blood pressure, pulse, and respirations. They constrict peripheral blood vessels. They are used to restore cardiac rhythm, treat hypotension, dilate bronchioles and respiratory distress, constrict capillaries when bleeding. Some examples are norepinephrine or epinephrine, which treats hypotension. Adrenergic drugs, epinephrine or adrenaline, or EpiPen also falls under this classification, treats anaphylaxis, asthma, and cardiac arrest. Ephedrine, used to increase blood pressure and also sometimes is used to treat or help patients with weight loss. Norepinephrine, used to treat hypotension and shock, and dopamine is oftentimes used to increase blood pressure.
If you need to administer an EpiPen for yourself or others, it's easy to use in 2 simple steps. If there's an emergency, these 2 simple steps could save your life or someone else's. Hold the ergonomically designed EpiPen in your hand and 1. Pull off the blue safety release, which will unlock the device. Now the EpiPen Auto-Injector is ready to use. A clear window shows if the EpiPen has already been used. If the clear window is obstructed in any way, or if the device does not fit into the carrier, it should not be used. 2. Place the orange end of the EpiPen against the outer mid-thigh and push firmly into the thigh so it clicks. Hold it there for approximately 10 seconds to make sure all the medicine is delivered. Seek emergency medical attention right away. Take the EpiPen Auto-Injector with you to the hospital emergency department. There is no need for concern about an exposed needle, since it is protected both before and after use. You'll also find easy-to-read instructions printed on the EpiPen Auto-Injector. It's as simple as 1, 2. Remember these 2 simple steps, and always keep your EpiPen Auto-Injector close at hand to stay prepared.
Yes, it is very important that patients carry the EpiPen at all times. Another thing is it is also okay for patients to administer EpiPens through clothing. Adrenergic blockers. They calm the nervous system down. They decrease the pulse. They slightly decrease the blood pressure. They cause vasodilation. They reduce the cardiac output. by decreasing the heart rate and the force of contraction. We use this for hypertension, cardiac arrhythmias, angina, headaches, and migraines. There are also two different types of adrenergic blockers. There are alpha blockers and beta blockers. Alpha blockers always end in Z-O-S-I-N, Zosyn. Some examples are doxazosine and tamsulosin. Beta blockers ending in O-L-O-L. Some examples are metoprolol, atenolol, and propranolol. Adrenergic blockers, so propranolol or Inderal, mainly used for headaches and migraines. Metoprolol, used for arrhythmias, angina, and hypertension. Carvedilol or Coreg, oftentimes used for arrhythmias, hypertension, and mainly CHF or congestive heart failure. And then Timidol is used for glaucoma. Adrenergic blocker drugs are the following. We have doxazosine, prazosin, tamsulosin, and terazosin, mainly used to treat BPH. Alpha blockers always end in Zosyn. Alpha blockers affect the vascular smooth muscle. Cholinergics. They release acetylcholine, and they increase fluid flow, they increase peristalsis and bladder contraction, they increase muscle strength, and they decrease respirations. They also decrease intraocular pressure in patients with glaucoma. Conditions that these are used for are glaucoma and usually urinary retention. Cholinergic drugs, we have urocholine for urinary retention. We also have pilocarpine for glaucoma. Cholinergic blockers, they decrease GI motility, they dilate pupils, and they increase the heart rate. We oftentimes use these for diarrhea, eye exams, and bronchospasms during asthma. Oftentimes these are rarely used because of they severely slow the body systems down. Cholinergic blocker drugs, atropine is used for bradycardia. AV blockers and perioperative. Scopolamine or transderm scoop is used for motion sickness. A lot of patients use this while they're traveling. And then Donadel is used for irritable bowel syndrome.